Let's take another look at our lead story, talking about the acquisition of vaccines, storage capacity and vaccination of the citizens here in Nigeria. Joining us live from Abuja is the Executive Director of the National Primary Healthcare Development Agency, Dr. Faisal Shuaibu. Thanks a lot for joining us on the News at 10.
Thank you for having me.
We've looked at the efforts that you've made to give assurances that the facility is there to store the vaccines when they arrive. But others are talking about electricity in this country, and perhaps are we able to withstand that with the vaccines now when they arrive? Will it be able to withstand the kind of power supply we have here?
Vaccines are an item of national security. So aside from the COVID-19 vaccines that we're expecting, Nigeria has always stored routine immunization vaccines in our strategic stores. We have stores in the zones and also in the states. So these are institutions that are given priority when it comes to making sure that they are connected to the national grid and there is backup supply of power. So we do not compromise when it comes to the issue of making sure that there is electricity supplied to these vaccines. Because if we do not keep these vaccines at the right temperature, then they lose their potency.
This is not a routine vaccine. Yes, you've talked about the fact that there is electricity for routine immunization, but the temperatures we're talking about for the COVID-19 vaccines are quite different, and perhaps that's what the worry is all about. You heard Gloria talk about 2 minutes in terms of when the facility is opened. What is the plan for getting people trained to manage it even when the vaccines arrive?
So I make a comparison to the routine immunization vaccines because this ultra cold chain equipment, the Pfizer vaccine that will be coming, also require a cold chain. It's just that the cold chain requirement is much lower than what we're used to with routine immunization vaccines. So minus 70 degrees Celsius, but they're going to be kept in the same environment. That is to say, the power will be sufficient to make sure that the vaccines are kept at the right temperatures. And we have already trained our health workers on how to manage and maintain the ultra cold chain equipment. So we do not foresee any challenges with making sure that this equipment are kept functional. As you showed in your report, these vaccines are going to be kept at even minus 80 degrees Celsius, just to make sure that we have the right environment. So training has been done and will continue to train folks at the subnational level, so at the state level, at the local government level, to be able to manage these particular types of vaccine. It is part of the comprehensive vaccine deployment plan that we have developed and will be rolling out in the next couple of days.
Yes, I'll come back to my question on the plan for distribution. For some other countries, they're talking about starting with healthcare workers, the elderly. How will this vaccine be distributed across the country when it's rolled out, bearing in mind the temperature?
Our priority is going to be making sure that the frontline health workers, the support staff, frontline workers, first responders, strategic leadership, people who have comorbidities, that have diseases in addition to COVID-19, the elderly. Those are the people that we're going to prioritize. And in deciding the quantities of vaccines that go to the different states, clearly we have to look at the epidemiology. Where exactly do we have the hotspots? Where is the disease occurring? Which are the LGAs that need to be focused on? And then where are these health workers? The health workers that we have are the heroes of the COVID-19 outbreak in Nigeria. This is why they are the ones that we're going to be prioritizing to make sure that when they come in contact with the patients that have COVID-19, that they are protected. So they will be the priority when we get the first doses of COVID-19, which really is a drop in the ocean compared to exactly what we need in Nigeria. 100,000 doses doesn't even go far enough.
And just to find out quickly now, looking at the topography of our nation, do we have the cold trucks that are going to transport these vaccines around different parts of the country, refrigerators, etc., mobile trucks as well, that are cooled, bearing in mind the kind of temperatures we're talking about?
We're working with the private sector to make sure that just as we've been able to transport routine immunization vaccines over the last few decades without any hitches, we have those trucks that are on ground that will be transporting the vaccines to the states, to the local government areas and the health facilities. But particularly for the COVID-19 vaccines, we need to transport them with dry ice, which is frozen carbon dioxide. The private sector will be providing us with this dry ice. Now, what we've been told by Pfizer is that we'll be able to keep these COVID-19 vaccines outside of the ultra cold chain for up to 5 days. Now, with the dry ice, we've been able to collaborate with the private sector, and the dry ice will make it possible for us to take these vaccines outside of the ultra cold chain to where they are required. But I want to make it very clear that we are not planning to invest heavily in ultra cold chain equipment. We're not planning to invest heavily in the Pfizer type of vaccines, because there are other vaccines like the Oxford AstraZeneca vaccines, which can be kept at +2 to +8 degrees Celsius, which is really the temperatures that most of our cold chain equipment can keep vaccines. So that is where we're really focused on. But for now, this is what we have. This is what we're getting from the COVAX facilities. And we need our health workers to be protected. That is why we've invested in this ultra cold chain equipment, to make sure that our health workers are protected, so that we cut down on the numbers of health workers that are getting sick and are dying. But really, our focus will be on those types of vaccines that are amenable to the types of equipment that we have, those types of vaccines that our health workers are already used to managing. And this is what we've sort of communicated to the COVAX facility, and in our conversations with the different manufacturers, this will be our priority.
All right, Executive Director of the National Primary Healthcare Development Agency, Dr. Faisal Shuaibu, thank you for joining us on the News at 10 tonight.
Thank you for having me.